Hello, and welcome to the Multiple Sclerosis Project by Samantha Brunn. This project will be broken up into 3 phases. The first phase is going to cover you an overview of multiple sclerosis, the onset and risk factors of multiple sclerosis, the symptoms of multiple sclerosis, and the prognosis and treatment of multiple sclerosis. Multiple sclerosis is a disease of the central nervous system. Unfortunately, the cause of MS is still unknown, but it is thought to be a disorder where the immune system incorrectly is attacking the healthy tissues in the central nervous system. This includes the brain and the spinal cord. The immune system attacks the melanin sheath within the central nervous system, and that damaged melanin sheath forms scars. And so when any part of that melanin sheath is damaged or destroyed in the central nervous system, nerve impulses traveling to and from the brain and spinal cord are interrupted. And this interruption is what causes a variety of symptoms. And multiple sclerosis can be mild, severe, or moderate. There are 4 disease courses. This is the clinically isolated syndrome, relapsing remitting MS, primary progressive MS, and secondary progressive MS. The most common type of MS is the RRMS. Moving on to the risk factors of MS and the onset. Typically, onset occurs in your 30s or 40s. There's no single test for MS, and the symptoms that surround MS can be caused by other conditions, so it can be hard to diagnose. The prevalence of MS is 1 in 1,000, and common risk factors include poor diet, limited activity. Additionally, other risk factors include gender, genetics, age, geography, your ethnic background, smoking, and MS is typically more common in populations further from the equator, as well as it's more common in women and people who have direct family members with MS. So one of the most common groups is Caucasians from Northern European backgrounds. And so there is definitely growing evidence, which we'll talk about a little bit later, about vitamin D playing an important factor for MS. And there's more evidence showing that vitamin D is a really good preventative factor for MS. So some of the symptoms of MS that may present could be loss of upper and lower body mobility, the function of your body, cognitive confusion, fatigue, loss of balance, loss of coordination, depression, mood swings, tremors, muscle spasms, bladder problems, difficulty swallowing, as well as many people with MS suffer from blurred vision and problems with speech. And so along with vitamin D playing a really important preventative factor for MS, studies have also shown that proper nutrition and exercise can help with symptom management. So the prognosis for MS, unfortunately, is terminal. Some people with MS will suffer paralysis while others will not. It really varies from person to person, and there's no cure for MS, but medications really help to reduce the number of relapses, and it delays the progression of the disease. Medications can be injected, they can be taken orally, or they can be infused. There's a lot of different types of medications out there to treat MS. And it is really important for a person, once they are diagnosed with MS, they really should be working with their doctor or a neurologist to make a treatment plan, so that the goal is to reduce their symptoms and delay the disease progression. However, challenges to treatment include cost, side effects of the drugs, and uncertainty if the treatment is even working. Next, we're going to move on to phase 2. Phase 2, we will talk about the genetics and environmental factors of MS, as well as stem cell research and MS. I will also show you a brain figure of a normal brain and an MS brain, as well as a melanin sheath. So, as I mentioned previously, low vitamin D is a risk factor for MS. There's also growing evidence from Larson et al. 2015 of the complex interplay between environmental and genetic factors which seem to trigger MS. Additionally, Larson studied the association between vitamin D levels and stimulate immunoregulatory cells. And in this, they found that there was an association between vitamin D levels and single nucleotide polymorphines. And so they really saw there was association between vitamin D levels and genetics, specifically in the key genes of GC, CYP2R1, NADSYN1. And all of these genes are key to the metabolism of vitamin D. So additionally, another study that I looked at was done by Soricilla et al. And this addressed the genetics and the age of onset for MS. And what they found was that there's a correlation between earlier age of onset for RRMS and SPMS, and that these also have the higher genetic score. So that is, I guess, good to get the early diagnosis for those that are genetically predisposed to the disease. Moving on. So one new and growing trend is stem cell therapy. It's a growing area of research within MS. It's described as unspecified cells in the body that retain the ability to generate cells of undifferentiated state identical to themselves or differentiate into other types of body cells with specialized functions. So the two stem cells that MS patients focus on are the MSCs and HSCTs. And they've really showed very positive results and shown it to be a viable treatment option for people with MS, but more research is still needed. Here you can see a healthy brain scan on the left and a brain scan with MS lesions on the right. Over here you see the nerve fiber of the melanin sheath. Finally, I'm going to briefly discuss the case study of Miss C. Miss C was a 35-year-old white female. She came in because of neurological complaints of heat intolerance, stumbling, loss of balance, a tendency to fall, difficulty holding objects in her hand, tremors, and severe exhaustion. An MRI scan was done, as well as a spinal tap and a visual evoked response testing. What was found in the MRI scan was that there was white disease matter in both cerebral hemispheres, as well as in the spinal tap. There was a prevalence of oligochondral bands, and in the visual evoked response testing, that revealed abnormally slow conduction in the optic nerves. So it was decided with that team of neurologists that Miss C had MS, and so from that, current problems that she was experiencing where she was weak, numb on her right side, she had impaired bladder function where she needed to have a pad, fatigue, and balance problems. Her family history was high blood pressure, cancer, and heart disease, so no MS in her genetic history. These are the references that I used. I hope you enjoyed this short presentation on MS. Thank you.